Hello guys, welcome to second screencast exam for Anatomy and Physiology, Unit 7. So basically, you get some exam questions again, same function as last week. What I want you to do is, first up, you look at the question, look at the mark allocation if there is one. From there, circle important information or write down the important information. If you feel you can either use a memory method or you want to use a memory method that I've done for you, you can do that and I'll put it onto the slide. It's not for everyone, and there's a couple of extra ones I'll put today. After that, you need to try and translate that into an answer, and then if it needs an example, you put that in on top. That's your focus. I will go through the questions now. Okay, so starting off, question 1. Identify 3 types of joints and provide an example for each. There are 3 different types of joints. Pause if you know it. Memory method. What we used yesterday, okay, that should lead you to be able to answer it. Pause again and write if you know it. Going on from there, your answer should be as follows. You can check and see if that is correct or not. Moving on. Okay, identify types of freely movable joints, okay, and give examples from the body. 6. There are 6 freely movable joints. You give an example from the body. There is no memory method for this, so I'm going to pause it now and see if you can think of them. Example from the body for each of the different types of synovial joint. Answer? There you go. Next question. Identify 2 types of cartilage and provide the location and function of each. Now, I've come up with something a little bit different for this as a memory method. So basically what we're going to do, firstly we need to know the 2 types of cartilage, so I'm going to give you the memory method. On here, memory message, cart. First 4 letters of cartilage, cart rhymes with fart. If we split up F and art, we know that the first type of cartilage begins with an F, and then it's got cartilage on the end. We know the second type of cartilage begins with art, and it has cartilage on the end. Now, when we're looking for functions of any type of cartilage, remember we're using the acronym CAR. Now, the word CAR links us to SCODA. SCODA should lead us to the function of all types of cartilage. There's your answer. Going on from there then, identify and describe the function of synovial joint structures. So when you have a synovial joint, it has lots of different structures that make it a synovial joint. Okay? Can you think of, firstly, can you identify the components of it? And secondly, can you start to think of the function? Now 4, I have given you kind of memory methods for. If you feel like you can answer these without memory methods, do so now. So if we start on here then, I've got ligament. Ligament is respelt to libabant. Cartilage is respelt, as we've talked about, car into SCODA. Tendon changes to tembom. Synovial fluid should be mentioned in all the other 4 structures. Okay, so from there then, the answer to that one will be, these are your key things. Have a look, see if you've got the right thing. You need to have named it, and you need to have the kind of function of each bit of it, or what's within it, and how it helps a joint become effective and efficient. Okay. Now, I'll call it a day there. I mean, the other one was, can you name the types of movements of the body? But we'll have a look at that a little bit further. So that's